The respiratory system. Let's see if we can understand how changes in our scientific knowledge have helped to solve human health issues. Let's have a think of some of the issues that can arise in the respiratory system. I've grouped them into two groups here, non-infectious and infectious. The non-infectious include things like asthma, cancer, emphysema, cystic fibrosis. Now, asthma is a disease that is brought on, a condition that is brought on, usually by environmental triggers, maybe exercise, or it's suddenly very cold. And it's where those tubes allowing air into the lungs start to become constricted and inflamed, and the hole in the center gets smaller. Cancer is often caused in the lungs by smoking. There are some other environmental things that can happen, like exposure to asbestos. Lung cancer is dangerous because it actually changes the function and the structure of the lung tissue. So instead of being full of air holes, a big mass will grow and just take up space. And that space can't be used for gas exchange. That's why the cancer in the lungs is bad for the respiratory system to actually function. Emphysema is a disease which smokers get, and it's where the alveoli stop having a large surface area and actually have a small surface area, which reduces the ability to exchange gases. So emphysema sufferers often are very short of breath. Cystic fibrosis is a genetic disorder, and here the mucus in the lungs, so the very inside of the lungs, which is moist, that now, instead of being moist in a thin moisture, it actually becomes very gloopy and thick, which makes it very hard for that mucus to be removed from the lungs, and it actually sinks into the lungs. And again, it starts to clog up some of those tubes that are very fine and some of the alveoli, and reduces the ability to do gas exchange. And here are some infectious diseases. Pneumonia, which can be caused by viruses and bacteria, COVID, caused by a virus, influenza, also a virus, and TB or tuberculosis caused by a bacteria. All of these infectious diseases reduce our capacity to exchange gases. They make us short of breath, they reduce the oxygen in our system, and that's what makes us unwell. So let's have a look at some of these pictures of the lungs when they are affected by disorder. So here you can see a mass of tissue growing where there should be alveoli. So this would be lung cancer. Here we've got a picture of some damaged alveoli. So instead of being clear circles where gas exchange can take place in every surface, here we have inflammation or damage, and they can't do gas exchange. So this would be something like emphysema. Here we have a picture of a normal tube going into the lungs, so maybe a bronchus or bronchiole, and here it has become inflamed and constricted, and the hole in the center has been reduced. So this would be a good example of an asthma lung actually under attack at the time, and it's changing its structure. Thankfully, science and scientific knowledge has been able to produce technologies which help to combat these disorders. So, for example, there are asthma inhalers available that relax muscles and reduce inflammation so that asthma sufferers can calm their lungs down and allow those tubes to stay open. In severe cases, we can do lung transplants. If somebody is very compromised, we can take out their diseased lung and put in a new one, and that's very tricky. It's major surgery. You need a donor who has recently died to give their lungs to the patient, but you can do a little bit of research to find out more about that. And sometimes surgery can take place where a very small chunk of the lung is removed, and then although the person has less lung in total, the rest of the lung is healthy. So that can happen too.